Good morning, everybody, and welcome to Tuesday's Zoom class. The first thing that I want to talk about this morning is timeliness. So I want to talk about being given on-the-job projects. How many of you guys have been given an on-the-job project? All the time. I get them all the time. Let's just give an example. If you work at Walmart and you have to put up merchandise and you have a basket and they say, here's your basket, you have to have that put up before you go home this evening. That could be an example of a project. It could be something as easy as reorganizing super bills or going through scan folders or patient information. So when you're given a project and they say, okay, like at Walmart, you have to have it done by the end of your shift, which say you got there at 8, your shift ends at 5. When does that particular project need to be done?
Before you leave.
By 5 o'clock before you leave.
Yeah.
Okay. Say that you're having to go through scanned information and shred and pull out anything that doesn't mean anything anymore, and you're given 24 hours to do it. Does that mean you get 24 hours or does that mean you get 48 hours?
24.
24.
So who wants to go to your boss and say, I'm sorry, I did not complete that project in a timely manner. I need more time.
No one.
Okay. So what are your assignments essentially?
Our job.
Your projects.
Yes.
Your timed tasks. Okay. So this isn't calling anyone out. We're just talking about this because I'm a firm believer of right now, this is your career. This is your job. Even if you have a job, you're not going to have that job forever. You're actually coming to school for a new career, right? So when do you practice your new career? Right now. Being a medical billing and coding associate, even if your authorization for insurance or you're an accounts receivable person, whatever job in the medical field is all timely information. If you're given demographics for a patient and you've had 10 new patients and that has to be put in and that's your project for the day, you can't ask for more time. It is important to get it done timely. Your assignments are important to get it done timely, sorry. So we have another week in this module, but the module ends next, not this Friday, but next Friday. We should not be asking next week for time for more time on assignments that should have been done a week ago. So I'm just reminding you, this is your job right now. So you need to get career minded about your education and let's get our assignments done timely. Okay. That's understandable, right? You guys agree that that's important?
Yes.
Okay. So if you're doing that, I'm not saying that to you, right? So don't get your feelings hurt. This is just a very important point that I need to make is that if I'm the boss, if I'm hiring you based on your work, where are you going to land in that? Mr. Cedric said whenever you end the program, what's he going to do? He's calling me to say to me, okay, tell me pros and cons. I don't want the con to be, she didn't turn in her assignments timely. She was spotty on her attendance. I want to be able to say, find her a job. She's amazing. She's awesome. There's not one negative thing I can say about her. So, hi, Antoinette. So I just want us to be very cautious about not being timely with our assignments. Things happen, right? We had someone's grandmother passed away last week and she hasn't felt up to it. I completely understand that, right? There are times that you've been sick. There have been times that things go on and you let me know, just the way you would your supervisor at a job. Hey, I'm not feeling well today. So if I'm not talking or if I seem slower, I'm just not well. You know what I mean? It's the same kind of thing because you know what to look for. So I do commend most of you on communication. You guys are great with communication. And from the very first, I think, interaction that we've had together, I've always said communication is key. Right? Okay. Any questions about that? Excuse me. Okay. So we're actually going to do a lecture, and can you believe it? I have Google Slides to show. Isn't that shocking? They're my favorite. I just love them. But so again, we're in chapter 4 and we're doing healthcare laws. Okay, this is not going to be a jump up and down on the trampoline, fun thing. Sorry, I thought I turned that off. But it's need to know information anyway, right? So make sure that you have pen and paper to go ahead and take notes. Antoinette, don't you dare take notes while you're driving. Okay, so
I can't. I'm like 5 minutes from the house though.
okay, so the first thing we're going to talk about is privacy versus confidentiality, which I think what the slide that I have is going to put it more in perspective, because those two things can be very confusing when you're thinking about it. So we're going to work a little bit on that. We're going to do HIPAA. We're going to do the HITECH Act, the GINA Act, FDCA, CDSA, the Patient Protection and Affordability Act, OSHA, Good Samaritan laws, and laws for the end of life. I didn't even put all of them in. If you've read your chapter yet, you know there is a lot of them in there. But we are going to be learning something new today called the birthday rule. So that'll be at the end, and we're going to have a little bit of a quiz that we do together. It's NCCT prep. So, all right, so here we go. Let me share my screen. So chapter 4, module 151, healthcare law. So this was the slide we were talking about, privacy versus confidentiality. And I love that it's color coded because that just speaks to my heart. So privacy is the darker blue and confidentiality is the brighter blue. So if you're speaking about privacy, that's the state of being away from public attention. It's about individuals. It's about personal choice. It's about your right. And it's about restricts the public from accessing personal data. Versus confidentiality, where it's the state where certain information is kept secret. It's about information, not individuals. So confidentiality is about information. It's about personal obligation, not personal choice. Agreement, and restricts unauthorized people from accessing confidential data. Now, I know we just took a quick look at that, but did that help anybody? I know it helped me to remind me. So when you're talking about privacy, you're talking about more an individual versus confidentiality is not individualized. Is that how it put it? I don't think I put it as good as it did. Look at it again. Oh, privacy is about individuals. Confidentiality is about information. So I think that one's just a very important one to remember. Okay, so we're going to talk about HIPAA. We've never talked about HIPAA before, have we?
Oh, no.
First time. But this is the first time that we're going to talk about HIPAA Title I and HIPAA Title II. So of course, HIPAA stands for Health Insurance Portability and Accountability Act. So what is Title I? It's health insurance reform, and the objectives to Title I is to improve access and continuity of care, insurance coverage, prevent loss of coverage, and guarantee renewal of health insurance. So the enforcement agencies for HIPAA are the OIG, CMS, and the OCR, and that's going to be for both Title I and Title II. So Title II, preventing healthcare fraud and abuse and administration simplification. The objective to Title II is to combat waste, fraud, and abuse in healthcare, simplify the administration of health insurance. So this is a little bit different way of looking at HIPAA. We've never broke it down into, a part 1 and part 2. So I just found this very interesting. So let's talk about terms to know when you're talking about HIPAA. Covered entities, PHI, business associate, permission, de-identify, and limited data set. Okay, so part of your assignment for today is going to define each of these terms in detail and submit it to me. And you need to know these well enough that if they show up on a quiz, you're going to know them. These first three should be very familiar to you. All right, so we're always talking about HIPAA, but we're never talk about them in a scenario-based kind of thing. So I decided that we would just go through these 11 most common HIPAA violations. So number one is the lack of employee training. If you're not trained correctly to do your job. Medical record mishandling, using insecure technology, hacking and malware, authorization and patient signature, disclosing the wrong patient's information, improper disposal of PHI, lost or stolen devices, social media sharing, gossip and conversational breaches, and celebrity file lookups. Did you guys recognize any of those that we've talked about?
Yes.
Celebrity, you should remember that one, right? We talked about, was it Britney Spears? I can't remember who we used. But I do want to make a point. I had a previous student recently. Hi, Jasmine. I don't think I said hi to you. I had a previous student recently send me a photograph from her desk. Her computer was behind her. And she had patient demographics on that computer. And her statement was, but it was just you. I was like, no, ma'am. Nobody. Don't ever let it happen again. So if you're shooting a picture for your honey and you have stuff out on your desk and it has any sort of information on it, and you're just wanting to say hi, go to a separate spot. You don't want to get anybody's personal health information. And the reason that I'm bringing that up is because we are a selfie society. We're always taking pictures of ourselves. And that's just one of those simple things that we may not even stop to think about, right? So always be aware of what's around you. So I just wanted to share that. I've been saving that story. She was like, you're not even my teacher anymore, and you're getting on to me. I'm like, yeah, I'll always be your teacher, especially if you do something like that and you're in HIPAA violation. And remember, we also talked about the student who put vaccine records underneath the front mat at the facility so somebody could come pick them up. Y'all remember that story? Her supervisor-ish person told her to do it and she complied. And I said, don't ever do it again. Because if she wants that done, she does it. That makes your hands clean. So anyway, so HIPAA is very, very important. And some of those things we've talked about, and excuse me, and some of those things may be new, but I thought it was a neat little list for us to look at. Okay, so next we're going to be talking about the HITECH Act, which stands for Health Information Technology of Economic and Clinical Health, sorry. We're going to watch a little video. It's only like 4 minutes, but this is the question that I want you to write the answer down to. What year was this act signed by President Obama? So let's play our.
If you're like most doctors, you've probably heard something about a government incentive program encouraging physicians to implement electronic health records. However, you're probably a little fuzzy on the details. Well, you're not alone. Let's take a closer look and see if we can help you make sense of it all. On February 17th, 2009, the American Recovery and Reinvestment Act, also known as the stimulus package, was signed by President Obama into law. Contained within its pages is new legislation known as the Health Information Technology for Economic and Clinical Health Act. That's a mouthful, so we'll just call it the HITECH Act. So what exactly is the HITECH Act? And how does it affect you, a physician? Well, very simply, it uses financial incentives to encourage physicians to adopt certified electronic health records, or EHRs. Through the increased use of EHRs, the government hopes to achieve the goal of a national health information network that will result in improved quality of care, patient safety, and lower costs. What kind of financial incentives are we talking about here? Perhaps as much as $34 billion. So now you're probably asking yourself two questions. One, how do I qualify for this money? And two, just how much of that $34 billion is available to me? Well, the answers to both of these questions are actually quite simple. To qualify for a piece of the high-tech money, there are two things you will need to do. First, your practice must purchase and use a government-certified EHR. Secondly, your practice will need to demonstrate meaningful use of this EHR. This means that you will have to prove to the government that the EHR is being properly implemented according to their criteria. This criteria is detailed in a list of 25 requirements issued by the Department of Health and Human Services and is broken down into two sets of objectives and measures: a core set and a menu set. The core set consists of 15 non-negotiable objectives that all physicians must comply with. In the menu set, however, providers are free to choose 5 items from among a menu of 10 to implement. In all, this means physicians must meet 20 total objectives in order to demonstrate meaningful use. Fail to meet even one of these meaningful use requirements, and you become ineligible for the incentives. Now that you know how to qualify, let's find out how much of that $34 billion you can get your hands on. The answer to this depends on which incentive program you are eligible for. HITECH provides 2 separate programs, one for Medicare and one for Medicaid. With Medicare, physicians can earn up to 75% of their Medicare allowable charges, up to a maximum of $44,000. With Medicaid, close to $64,000 is available to physicians who see more than 30% of Medicaid patients. That number is reduced to 20% if you're a pediatrician. Keep in mind, this incentive is for each eligible provider within a practice. For example, have 5 providers on the Medicaid program, and your practice can receive up to $320,000 in incentive funds. Unfortunately, though, the HITECH Act is not just about handing out free money. Delay, or even decide not to implement a certified EHR, and you will be penalized. Not only will you lose out on the incentives, but the government will also begin decreasing your reimbursement rates by as early as 2012. So as you can see, at its core, the HITECH Act is not that complicated at all. Simply purchase and use a government-certified EHR, meet all of the meaningful use requirements, and you'll be eligible for the HITECH incentives. And on a final note, be aware of the fact that commercial insurance carriers are already talking about jumping on the meaningful use bandwagon and requiring providers to meet the same criteria for their pay-for-performance programs. Hopefully this has given you a clearer understanding of the HITECH Act and what it means to you and your practice. Over the next several years, EHRs will change the way we as healthcare providers keep patient records. Change is coming fast. Act now to make sure that you don't miss out.
He's like, dude, I'm like kind of lost. I'm like, it's only been a couple days, bro.
Well,
Now I can hear you.
I turned my mute off. Sorry about that. So who learned something? Did you ever realize that doctors who agree to take Medicare and Medicaid patients actually get incentive money? But do they just get handed the incentive money? No, they have to complete a required list. a couple of the things that were on the list was things like patient education information. So many patients have to get that education information. It has to be documented. I mean, so we called it PQRS. I'm not going to get into all of that, but I think we've talked about before for the cardiologist. So many patients, you got credit for however many patients that you gave said take aspirin to, or how many were on Coumadin, or how many EKGs you did. They're very, 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 very strict. Hi, Sean. They're very, very strict on what you have to check off of those lists and the documentation that has to be proven from that. Okay, so who can answer the question? Kelly?
The
February
year,
17th of 2009.
2009.
Yep.
Okay, this is my next question.
Yeah, that's mine, so.
Okay, guys, y'all make sure that I'm on mute, please. Thank you. Okay, so here's my question. Can your facility choose just any EHR that they want? What do we have to have? We have to have a government certified EHR. So it's not all the physician's choice on what they get. Has to be, in order for them to get the incentives, they have to have a government certified one. So anyway, so any questions about the HITECH Act? HITECH Act. All right, we're going to keep rolling then, ladies. Okay, this is the GINA Act. So what is the GINA Act? It's Genetic Information Non-Discrimination Act of 2008. So what this act means is employers may not use genetic information in making decisions related to terms, conditions, or privileges of employment. It includes a person's genetic tests, genetic tests of the person's family members and family medical histories. It forbids unintentional collection of this data and forbids harassment of an employee because of genetic information. Okay, so that really sounds not necessarily confusing, but very broad. So we have a couple of, or a scenario for you to think about. So Gina in the workplace case scenario. While on break, a worker at a water cooler, Carol tells her coworker Bob about the battle her mom is having with Huntington's disease. Carol tells Bob that Huntington's disease is a progressive degenerative disease that causes certain nerve cells in the brain to waste away. As a result, a person may experience uncontrolled movements, emotional disturbances, and mental deterioration. Carol tells Bob that she fears she is at risk for this genetic disease and that she periodically uses the restroom at work, a direct-to-consumer testing kit she purchased over the internet. Okay, so that's Carol's talking to Bob about that. So number one, can Carol be fired or denied a promotion due to her risk of Huntington's disease?
no,
No, she cannot. It's against the law. And question two, if Carol needs to take a leave under FMLA to care for her mom, can the employer use the information on the forms to discriminate against Carol?
No. No.
Not supposed to, right?
no,
It's against the law. Does it still happen? Yeah, probably. But, you know, we can't control that. But it is against the law to use genetic issues against a person, an employee. See, it's going by pretty fast, guys. Okay, so let's talk about the FDCA, Food, Drug, and Cosmetic Act. It became a law in 1937. It replaced the Food and Drug Act of 1906. The FDA is responsible for safety, effectiveness, security, and quality of drugs, cosmetics, and food. The FDA website, fda.gov, provides useful information for a healthcare facility. Who knew that the Food and Drug Commission, it now has cosmetics in it? I didn't know that.
I
But
did for working at Walgreens.
well, it makes sense though, because makeup goes on your skin and it can be poisonous. And so, I guess when you think about it in a broad range, but that's something new that I learned and found very interesting. So there you go. Something I did not know. Okay, so let's talk about the Controlled Drugs Substances Act. The Controlled Drug and Substance Act criminalizes the possession of, trafficking in a variety of illegal drugs and controlled drugs. So here we have two lists, a Schedule 1. Well, no, we have several lists of what these drugs are classified as. So Schedule 1 would be like cocaine, methamphetamine, opioids. Schedule 2 would be like marijuana. I don't even recognize THC. I do recognize that. A couple of other ones. Schedule 3 is amphetamines, GHB. I've never heard LSD. I've heard of that one. So Schedule 4 is barbiturates, anabolics, anabolic steroids. Sorry, anabolic steroids. Schedule 5, proflexidrine. Schedule 6, ephedrine, pseudoephedrine. I don't even know what any of those are. Potassium, hydraulic acid, and then so on and so forth. We don't have to go through all of them. But look at Schedule 8 is marijuana up to 1 gram. So those are your controlled drugs and substances, and those are the scheduled 1, 2, 3, 4, 5, 6, 7, 8. Okay. So I don't think if you can see the cartoon, it says, look on the bright side. We can expect. Oh, no, I can't read it. Sorry. I'm going to it was cute. But Patient Protection and Affordable Act. So Patient Protection and Affordable Care Act and Healthcare and Education Reconciliation. This was re-signed in 2010. And the goals is to improve quality of Medicare services, support innovation, establish new patient modules, align payments with cost, strengthen program integrity, and secure financial future of the program. It requires the secretary to establish the Medicare Shared Saving Program with a 3-part aim: better care for individuals, better care for populations, and lower growth in expenditures. What do you think would happen to our elderly generation if there were not laws to protect them? Now, already, I think maybe we probably pushed some of those, right? But if there was nothing holding them accountable, their caregivers accountable, then it would be even worse, right? So it's great that we have those things to hold caregivers accountable, nursing homes, rehab facilities, things of that nature. So who's heard of OSHA? I think pretty much all of us have heard from OSHA. Y'all aren't saying anything. So what is the purpose of OSHA? It's to assure, so far as possible, every working man and woman in the nation safe and healthy working conditions, and to preserve our human resources. Good Samaritan laws. Laws that protect people who give first aid in a good faith and without gross negligence or misconduct. Provides complete legal protection, and anyone given first aid should be properly trained and should apply the correct procedures or skills. So the Good Samaritan law just means that if you see a person who is in need of first aid and you can safely provide it, that you can, and you're protected under law. Okay, so laws for end-of-life issues. So the very first act that we're going to talk about is the Patient Self-Determination Act. This requires most healthcare institutions to inform patients of their right to make decisions, facilities policies respecting advance directives always. The UDDA, Uniform Determination of Death Act, is a guide for state lawmakers to create their own laws that define death. Uniform Anatomical Gift Act, this is about organ donations. National Organ Transplant Act, and established National Registry for Organ Matching. So next, we're going to talk about compliance. Compliance with public health statutes. Healthcare providers have a responsibility to report specific information to various authorities: births, deaths, specific diseases, sexually transmitted infections, specific injuries related to violence, abuse, neglect, and exploitation. So we're going to talk about critical thinking 4.6. This is in your book, but I have it on the slide. Daniela is learning about public health statutes and reporting obligations of providers. Why is it important for the public health services to be notified about specific diseases? Antoinette, I'm expecting you to know this answer. We all should know this, right? Because we've been going through COVID for how long? It's for public safety, right? It's so that people can begin to protect themselves and that we can get ahead of what's spreading. Okay, we're not going to spend any more time on that. Okay, reportable diseases. What actual diseases are actually reportable? Communicable diseases that have significant public health impact. Some examples are hepatitis A, food or water disease outbreaks, pertussis, measles, and the plague. Less urgent reporting are going to be sexually transmitted infections, Lyme disease, hepatitis B, C, and D, and E. And highly confidential acquired immune deficiency syndrome, which is AIDS and HIV infection. And I did actually put on the bottom, COVID is reportable. Okay, so this is the second part of your assignment. Research reportable diseases, choose 10, give a description of each, and submit. I do not expect a full page of them, but please write in full sentences. Watch your grammar. Just give a general quick description of them. So that's your two assignments. The terms to know and these reportable diseases. So, okay, so wounds of violence. Guys, this is so important. It's on the NCCT. Statutes vary state to state. Typically, reportable cases include wounds caused by gunshots, stabbings, specific types of burns, knife, axe, and short-pointed instruments. So let's do some closing comments and patient education. Take the time to explain forms as needed. If appropriate, use simple phrases when answering questions. If possible, help communicate. Deep breath. If possible, help complete whatever information you can. Should a medical assistant feel that a task conflicts with the law, talk to your supervisor. Always be focused on your patient. Be upfront and honest about errors with your supervisor, provider, and patient. So now we're going to talk about a couple of the forms. You guys have pictures of all of these in your ebook. The first one is the disclosure of authorization. This is required by HIPAA. Of the final privacy rule states that covered entities may not use or disclose PHI without a valid authorization, except as otherwise permitted or required in the privacy rule. Sorry, I got a little choked up there for a second. Okay, The medical records release form, also known as the medical information release form, is a form used to request that a healthcare provider, physician, dentist, hospital, chiropractor, psychiatrist, etc., release a patient's medical records, either to the patient, a third party, such as an employer, insurance company, or both. And the last one's going to be an incident report. So in a healthcare facility, such as a hospital, nursing home, or assisted living, an accident report is a form that is filled out in order to record details of an unusual event that occurs at the facility, such as an injury to a patient. The purpose of the incident report is to be documented the exact details of the occurrence while it is fresh in their minds of those who witnessed the event. This information may be used in the future when dealing with liability issues stemming from the accident. But per our quiz, that's not the first goal to an incident report. Who can remember what the first goal of the incident report is?
To keep from someone else being hurt.
To prevent future issues. Okay, so I'm going to ask a question. Are incident reports just for patients?
No.
No, they're not. They're not. They're for employees too. I'm just going to give you an example. When I was working at Rapides Regional Medical Center, we had this nice little fellow that was on transport. And what transport is they go get the patients and they take them to whatever division, CT, lab, whatever they're doing. And so this very nice, very elderly gentleman was in for a procedure. So he had to go have a CT done. Very nice man, but somewhere in between the move and having the test and getting back, he had some delirium going on. And he reached over and he bit this poor fella on the arm while he was pushing the bed. And let's just say he was missing parts of his arm. So that's a huge incident report, right? So then what the hospital had to do is look at ways for that particular incident not to happen. Well, number one, your hands are supposed to be behind the bed on the bar, not around the bed trying to maneuver things better. So there's reasons for that. But I just want to say the poor fella got to feeling better and felt awful for hurting this nice guy. But he just didn't know what he was doing. He had some delirium going on and being in a dark room and then didn't know where he was. And so, but anyway, that's the end of that story. I didn't want to leave y'all hanging like he was just, like Hannibal Lecter or anything. No, not at all. He was very sorry. So back to our slides. Okay, so now we're going to do our little NCCT preparation. So which of the following is an example of a Stark Law violation? A physician using self-referral, unbundling procedures, asking for payment from a minor, a physician receiving kickbacks. Kelly?
D,
I'm sorry, I couldn't hear that.
D,
D?
I say A. Oh, no.
Yeah, the answer is A. A physician using self-referrals. That's okay. We're going to keep practicing. The anti-kickback law and the Stark law are similar, so don't worry. Okay. A specialist gives a general practitioner concert tickets every time he refers a patient to him. This is illegal according to Kelly. Can you answer this one for me?
that one's D.
The anti-kickback law, right? Because it's
Yeah.
monetary value.
Right.
Okay, Jasmine, this one's going to be for you. During an annual audit, it is discovered that the office coding staff have upcoded procedures. Which of the following law applies? So when we code things, we put them on a claim form to be sent to the third-party payer to get paid. So
D.
D, the False Claims Act. Okay, let's see. Melanie, this one's going to be for you. Which of the following laws pertain to an insurance and coding specialist who knowingly presents an incorrect CMS 1500 for payment to a payer? So a 1500 claim form. Melanie, are you still there? Miss Elise, are you there?
Yes.
Okay, you answer this one.
Is it A?
A, right, because it pertains to the CMS 1500 claim form, and it's the Federal Civil False Claim Act. Okay, let's see who's here. Okay, Miss Roblin, you get the next one. I had to go back and see who is. Okay. All right. Which of the following regulations prohibits a physician from referring a patient to a facility in which the physician holds a financial interest? Talking about referring.
C.
C, the Stark Law, absolutely. Okay, so now we're going to talk about the birthday rule. Let's take a minute. Y'all know me, I'm just truck. Let's just take a minute and clear our mind because this is something new for us. It's called the birthday rule. It's important to know what the birthday rule is because it will be on our NCCT. And I don't want y'all to feel discouraged if you're still not quite getting the anti-kickback and the Stark Law. We're going to keep practicing that over and over and over again. I know y'all have seen the questions before. We're just going to keep doing them. Okay. All right. So here we go. Getting back to the birthday rule. The birthday rule is part of COB, which is coordination of benefits. So let's find out what the birthday rule is all about. The birthday rule is when a dependent child is covered under both parents' health plans. The plan of the parent whose birthday falls earlier in the calendar year pays first. So we're going to stop there. Okay. We see divorce a lot nowadays, right? And so when parents are co-parenting and they both have health insurance on their child, the question becomes, what insurance pays first? They're both a primary insurance. She has it through her work. He has it through his work, right? So how do you know what pays first? Because they're both primary insurances. It's going to be whoever's birthday comes first in the calendar year. So Mama's birthday is March 23rd and Daddy's birthday is January 29th. Who's going to pay?
Daddy.
Daddy, because his birthday comes before Mama's. That's the birthday rule. Does anybody have any questions?
So I do. With the birthday rule, does it matter like the year or is it just a month? Just say, for instance,
It's just a month.
just a month. Oh, okay.
It can get tricky because sometimes there's step parents involved in that and this or the other thing, but I don't think we have to get that deep into it. But especially if you're going to be working in a pediatrician's office, the birthday rule is something you're going to be using a lot of. So anyway.
Would that make it then one's primary and one's secondary insurance then?
No, they're both primary, but the thing about it is who will get the claim first. That insurance will get the claim first. Then it'll go to the other primary, but you have to have someone that's going to get paid first. Like both of them can't pay the equal amount. Does that make sense? So whoever goes first is going to pay the larger sum. Then the second one's just going to pick up what's left over.
Okay.
For those of you who are following the Medicare story for my mom, there has been no word. I will keep y'all posted. All right, any other questions? Well, I hope that you learned something. I know these acts and laws and stuff are not like Party City, but I tried to make it a little more fun. Try to do lots of talking to y'all so it doesn't seem so blah, blah, blah. All right. If you're not caught up on your assignments, please use this week to do so. If you need anything, let me know. Otherwise, have a great day. I love spending time with you. There'll be an 11 o'clock Zoom class on Thursday. And I plan to do one at 7 o'clock on Thursday evening for ICD-10 coding. We did last week and we had a lot of fun. It doesn't take a long time, guys. Usually it's about 30 minutes. But if you can't make it, I'll just keep putting it on Zoom. Did you guys see where it was?
No. I didn't.
It's in that gray portion on the side.
Mhm.
It should.
But I didn't see it. For some reason, it didn't show up.
I probably need to turn I'll go look at it right now, Miss Elise.
Okay.
I know it's wrong.
I went through each one of them to make sure that I wasn't missing anything, but I never could find it.
Why didn't you tell me?
No, I didn't,